Appreciate everybody being here. I've been keeping statistics. 80% of our millennials are still in the room, and only about 60% of them are on some electronic social media as we speak. So I appreciate your continued involvement. From the pork industry, there's three major organizations within the pork industry. I work for the National Pork Producers Council. We're the advocacy arm. So we have lobbyists on staff. I'm not a lobbyist, registered lobbyist myself. And we also work on international trade. We have the National Pork Board. The Pork Board works on research, education, and promotion of the product. They are not allowed to lobby or influence government. And then we work really closely with the American Association of Swine Veterinarians. So it would be unusual for a day to go by that the three organizations' staff are not talking to each other. I didn't get the message it's only a year, so the old gray-haired lady in the crowd is going to talk a little bit about way back history, in fact, probably before some of our millennials were born. Talk a little bit about our principles, current activities, and then future direction. I'm really proud to be part of an organization that's built their principles of production around the We Care principles. And the We Care principles are celebrating their 10th year this year. And they include things like food safety, animal well-being, public health, environment, employee care, and community, being a good neighbor. And so those principles are what underlie everything we do in the industry and what we are advocating for. Back in 1989, we had our first introduction of the Pork Quality Assurance Program. PQA was at that time focused on violative residues. We had a residue problem. FDA had talked to the industry and basically said, you fix it or we'll fix it, and you'd probably rather fix it yourself. And so that's the origin of pork quality assurance, was to say, make sure we have the protocols in place that if we use antibiotics, that they are properly withdrawn. We've stopped giving them. We've cleared them from the animal system, so when they go to market, if they're tested, they're not going to be above a violative residue level, and that they will be safe for consumers. And so in 1989, when this started, that was the main focus of the program. PQA Plus has evolved to become our flagship education program. In 1999, we started looking much more at not just avoiding residues, but what is appropriate use of antibiotics. I'm not sure who chose the term judicious, because as time went on and we actually started doing consumer testing and testing of the name, judicious didn't resonate very well. So we'll talk a little bit about what we changed it to as time went on. But in 1999, the pork industry and the American Association of Swine Veterinarians were one of the first. ASV was the first species group under AVMA's overarching Judicious Use Guidelines to come up with a species-specific. What was really cool about this, and it starts talking about partnerships, is that FDA gave us a grant to make sure that every producer that got recertified with pork quality assurance, when they were sent out their certification card and their booklet or whatever, they got a copy of the Judicious Use Guidelines. And that was funded by FDA money to print those, send those, make sure that those were in the hands of every producer. In 2002, as the antibiotic wars continued, and they were probably at that time still a war instead of the more holistic discussion we're having now, Pork Board issued a statement. It was also approved by the NPPC board that it was essential for public health, food safety, animal health and well-being, and the environment to maintain the effectiveness and availability of antimicrobials, and that all decisions involving the availability of those drugs needed to be transparent and based on sound science. So this was one of those ones where we started talking about human health and animal health at the same time. In 2005 is when we really moved away from just saying judicious, you must, this, and we got to the Take Care program. And this is when we did our focus groups and found out using antibiotics responsibly was a much more palatable term than judicious. And Take Care talked about all antibiotics, whether they were for growth promotion, disease control, treatment prevention. We partnered with some of the pharmaceutical companies to launch this to the top 50 producers, and it was mainly an awareness and educational. So, how do producers own this? We had the top 50 producers in a room, and within 2 weeks, 3 weeks, we had commitments from the producers that produced at least 50% of the pigs going to market that they were going to follow these principles. The other really cool thing about this, with Pork Quality Assurance Plus, we've always had FDA take a look and make sure that what's in there is consistent with what their regulations are. With this was the first time we asked CDC to look at what we were doing. And so CDC at that time was a little shocked that we were encroaching on them. We started probably in 2003 coming down for visits. It's like, hey, we're coming, who wants to talk to us? And by 2005, we actually had enough of a relationship that we could say, give us your input. We changed some things based on their input. There are other things we didn't change, just like the pharmaceutical companies gave us input. We changed some things. There were some things we didn't change. And so it was really a good process. I actually have Dr. Fred Angulo on video saying that this was a great step. So it was one of my favorite moments in this discussion. In 2007, we moved to Pork Quality Assurance Plus. And the big move of Pork Quality Assurance Plus was that we added animal care into the program. But we also rolled in those Take Care, Use Antibiotics Responsibly principles into Pork Quality Assurance Plus. The other thing that this started was the first times we really started looking at on-farm assessments. Not only are we being educated, do we know what we're supposed to be doing, and are we doing it on the farm? Do we have an assessment that says not only do we know what we're supposed to do, but that we actually are doing it? It is a voluntary program, and I'm air quoting for those who can't see it, because really, if you're going to sell pigs to any of the major packers that are being USDA inspected, they're requiring Pork Quality Assurance Plus of their pork suppliers. So as a farmer, I can't sell a pig unless I'm Pork Quality Assurance Plus certified, and that the trucker that delivers my pigs has got a trucker's quality assurance certification. We're on version 3 of PQA Plus. Every 3 years it tends to be revised, so version 4 will be due out in the spring. And included in version 3 was an extra industry guide to responsible antibiotic use that focused a lot with the VFD and the Guidance 213 changes. I think it's important to look at the principles. The principles really haven't changed since 2005. One is we need to take every step we can to decrease the need to use antibiotics. We can talk all about use, we can talk all about resistance. Let's talk about decreasing the need. How do we take the best care of our animals so we have the least need to use antibiotics? And then when we do need to use antibiotics, what are the advantages and disadvantages, not only for our bottom line or for how we administer them to animals, but what are the disadvantages potentially to animal health or public health due to resistance? Use antibiotics only when they provide measurable benefits. That's a tough one, but we do have to have some kind of a follow-up to say, are they doing what they need to do? Implement management practices described for responsible animal health products, such as record keeping, needle use, disposal, things like that, and have a veterinary client-patient relationship. And then we go on to have guidelines, and that includes, number one, having the veterinarian be the major input for decision-making on antibiotic use, regardless if it's an over-the-counter or a prescription antibiotic. Antibiotics used for prevention, control, or treatment only when there's a clinical diagnosis. The nice thing about pigs is there's a lot of diagnostics going on. It's very rare that you just shotgun something. There's usually very good diagnostics. We have great labs. We have veterinarians and field people who know to send samples to the labs. And then we should limit their use to the ill or at-risk animals, so treating the fewest numbers of animals that we can. And those that are important for treating antibiotic-resistant infections, whether it's in humans or animals, should be used only after careful review and reasonable justification. Then we get into some of the legal stuff. Mixing together antibiotics is usually illegal unless it's done by a veterinarian under compounding rules. And then minimizing environmental exposure. So in 2014, we've had the PQA Plus assessment since 2007. Packers came together and decided that they wanted to be able to have a common audit that they could use for their purposes, to whether they were supplying somebody like HelloFresh or McDonald's or whomever. They wanted to be able to say, here's what we're doing on farm with an audit that says we do what we're going to do. So that was implemented in 2014. It's done by third-party auditors that are approved by an auditing association called PACO. And the standard audit demonstrates compliance with PQA Plus, largely focused on animal care, but we do have other items in that audit. So we have things about, do you have a VCPR? Do you use the correct needles? Do you have the correct records? Are they retained for the amount of times? And then I think one of the most important things is, can the caretakers, when you talk to them, tell you what they're doing, why they're doing, and how they should be recording what they're doing? And I had the privilege of following Mary Buttrell, who's going to be up later, around on 4 audits this fall. And it was really encouraging to talk to the caretakers, have them tell you what they're doing, and have them get excited about why they're doing it. So I think this has really paid off. So what are we doing moving forward? You've heard from Kathy and Joe about the Pew and the Farm Foundation efforts, and NPPC and the Pork Board have been involved with that and have agreed to those definitions, core components, and guiding principles. You know, we'll have future discussion about what the next steps are with those efforts. We have a lot of domestic and international efforts. It's good for Mike to tell us what AVMA is doing. One of the things I forgot to put on here is the fact that we did also, from both National Pork Board and NPPC, put forward commitments on the AMR, the CDC AMR challenge. We continue to interact with CDC. We're trying to make an annual trip down there. We just came back a few weeks ago, and I hope I'm invited back. And so the other thing we've been very involved with is the PACCARB that Mike mentioned, the work they're doing to try to. It was amazing. I was lucky to be a liaison, to have people who are at the top of the human medical profession listening to veterinarians tell stories and going, wow, that happens. And of course, Mike Apley has great stories. You always hear him go, and it was this big. And I'm going, I don't want to know what was that big. But it was really good, I think, just to build some understanding about not only the differences between veterinary practice and medical practice, human medical practice, but also some of those similarities. So if nothing else came out of that group, just having that level of discussion with influential people in both areas, I think was excellent. OIE, Michael talked a little bit about as well. We're very involved with the General Assembly, or the General, I think it's the Assembly meeting this spring, actually defined veterinary medical uses. They tried to define them as therapeutic. It came out as veterinary medical and non-veterinary medical uses, and listed treatment, prevention, and control as veterinary medical uses, so those that really are focused on animal health. Codex Alimentarius will have our task force in December, working on a code of practice to minimize the resistance, the development and spread of resistance, focused on foodborne transfer of resistance, and also working on a document on integrated surveillance. WHO issued a report a year ago that has some different opinions than some of the other groups. So trying to engage how do you engage WHO, and what is their place in international standard setting. FAO continues to have activities going on around, especially working with developing countries. And then the United Nations General Assembly by next year will be coming back with a report on national action plans on both human and veterinary medical uses. So in summary, we're looking at driving antimicrobial stewardship to minimize the development and spread of resistance. and preserving the effectiveness for both animal health and public health. I think sometimes we feel if we do a lot on the farm, somehow it'll show up in human medicine. And I'm not sure how much noise there is that we will ever be able to really demonstrate something, or even perhaps on the farm, where maybe what we change will not demonstrate that it's making a difference on resistance. There's a lot of noise on what causes resistance selection. But what we can do is say, we're being thoughtful, we're being careful, we're using antimicrobials only when necessary, and we're doing our part to try to preserve their effectiveness. And so we really need to work as hard as we can to maintain public and consumer trust, as well as working with our legislators and regulators, so that as an industry we can retain the tools necessary to ethically grow pigs and produce safe and wholesome pork products.